It's time for a Wellness Revolution. Brought to you by Hotze Health and Wellness Center. Honest discussion on maintaining health and wellness naturally to enjoy a better quality of life.
He's the doctor fighting to let you keep your doctorate.
Now, Dr. Stephen Hotze.
Welcome to Dr. Hotze's Wellness Revolution. I'm Stacey Banfield here with Dr. Stephen Hotze, founder of the Hotze Health and Wellness Center. And hey, everybody, we believe that everybody needs a health coach. We have got such good information online. All you have to do to download our podcasts is go to hotzepodcast.com. That's HOTZE podcast.com. Now, we have been actually running into this recently with some of our new guests, Dr. Hotze, with ladies who overall say that they're being pretty healthy, but then you dig a little bit deeper and you find out, well, maybe they're not on any pharmaceutical drugs except, oh, wait a minute, they're on birth control. So maybe you could speak to that to our audience and why that might not be the best idea.
Right. Birth control pills are counterfeit hormones. They contain an estrogenic counterfeit hormone that mimics the estrogen a woman produces in her body normally in the ovaries. And it also contains a progestin, not progesterone, progestin, a chemical counterfeit drug that mimics the progesterone hormone. And what happens is that the birth control pills, because they're counterfeit hormones, they suppress the production of the natural hormones that occurs during a woman's menstrual cycle, which includes ovulation in the middle of the cycle. So in a perfect 28-day cycle, a woman is going to make, starting after her period's over, she's going to start making estrogen hormones, proliferating the inner lining of the uterus. Mid-cycle, she will ovulate and give off an ovum, which is the egg, which lives about a day. But at that area in her ovary where she produces the ovum, it's called the corpus luteum. And she produces from that area of her ovary progesterone to balance the estrogen out. And that's the normal cycle. There's no pregnancy. The ovaries quit making their hormones, let's say on a perfect world, day 28, and then sloughs the inner lining of the womb, has a period and menstrual cycle, and then starts all over. So it's cyclical in nature. Oftentimes, ever since the early 60s, when they came out with birth control pills, OB-GYN doctors give birth control pills not only to prevent birth or conception, but also to treat a host of other problems, irregular periods, mood swings, you name it. They're going to give those birth control pills to these young girls to help them.
Acne is a common.
Acne is another one. Give them for acne. But remember, when you give these birth control pills, or when you take those, ladies, you are taking chemical substances that never existed before in nature. And so women commonly take these for, to prevent pregnancy. They have PMS. They got heavy bleeding. They got endometriosis, hot flashes, menstrual migraines, irregular periods. Doctors will put them on birth control pills. Now, the birth control pills, as we mentioned, suppress the normal production of the hormones in the ovaries. The hormone, counterfeit hormone in the birth control pill that mimics progesterone is progestin, but it's not progesterone. It's interesting. Conventional doctors, OB-GYN doctors, don't understand that a progestin in the birth control pills or in pills for women after they go through the change of life, when they take Provera, which is a combination, or Primpro, which is a combination of Premarin and Provera, which is a progestin. It's not progesterone. I've mentioned OB-GYN doctors. Why would you give a progestin instead of progesterone? Why would you give Provera instead of progesterone? They went, well, there's no difference. I met with, several years ago, one of the leading OB-GYN doctors in Houston and really in the country. He heads up the OB-GYN department, or did at that time, of one of the major medical schools in Houston. There are two of them, so it's either Baylor or UT. And I'm not going to out him, but I met with him for lunch with another OB-GYN that wanted me to meet with him. And we talked about the importance of progesterone. my doctor friend and I talked about the importance of progesterone. He said, well, there's no difference in progestin and progesterone. There's no difference. So, well, let me ask you a question, doctor. Can you give a progestin like Provera to a woman who's pregnant? He went, oh, my, no, you can't. Well, you can't because it prevents pregnancy, of course, and it causes abortions. And he goes, no, you can't. I said, So you think, so let me ask you this. If a woman's having recurrent miscarriages, what do you give her? Oh, we give them progesterone. Oh, so if a woman's having a problem with miscarriages, you give them progesterone, but you can't give them Provera because it can cause them to have a miscarriage. He goes, yeah, I guess they're not the same. He guesses they're not the same, and he's the chairman of the OB-GYN department, and he doesn't know the difference. He doesn't know the chemistry. He's been taught by his predecessors and by the pharmaceutical company. There's no difference, and there's a huge difference. That's why, and this is what happens. So when you don't have progesterone balancing out estrogen hormones, and you have some progestin which doesn't do that, it suppresses the ability of your ovaries to produce progesterone, ladies. And so you're not producing any progesterone. Well, so what happens? So you get estrogen dominance. You end up having fatigue. You'll have difficulty with weight. You'll have mood swings. You won't think clearly. You'll have poor sleep. Maybe you have joint muscle aches and pains. You'll feel unhealthy. You don't feel right. I've had so many women say, I started taking the birth control pills. I felt terrible. I had headaches. I had mood swings. I got fluid retention. I gained weight. I just didn't feel right. Well, of course you're not going to feel right if you put a foreign chemical in your body that never existed before in your body and your body wasn't meant to have, and it's going to turn off the natural production of your hormones, which is natural. How would you feel better? You're going to feel worse. So the birth control pills also adversely affect the body's ability to utilize thyroid hormone. Why? Because the estrogenic counterfeit hormones that are in, or drugs that counterfeit the hormones that are in the birth control pills, cause the liver to produce high, it gives them estrogen dominance and gives a woman estrogen dominance and causes her liver to produce high levels of thyroid binding globulin, which bind thyroid hormone, which means they can't get enough thyroid in the cell, and the thyroid hormone is what enables the cells to produce and use energy. They don't produce enough and use enough energy. Their metabolism down, they feel sluggish. They don't do well. That's because they're taking birth control pills. So I highly recommend the not using birth control pills. You might say, well, how am I going to keep from getting pregnant? Well, this is not rocket science, okay? First, you can only get pregnant one day out of the month. I know, but I don't know when it is. Well, learn the cycle. You cycle at mid-cycle. A woman, if your periods are normal every 28 days, you can ovulate on day 14. The egg lives for a year. You can restrain yourself, for crying out loud. But all of a sudden, unfortunately, fortunately for the human race, when a woman ovulates, she also secretes a little testosterone, which means she has stronger desires. And all of a sudden, that old ugly husband who's been a mean to her, all of a sudden looks like a pretty good-looking man. All of a sudden, she has the desire to reproduce the species, and he always does. So there you have it. But there's other, and you all are grown women, and you know there are other ways that you can protect yourself if you don't want to get pregnant. There's other means to do that. So you can learn how to do that, but there's no reason to poison your body every day of your life to keep from getting pregnant. That just doesn't make sense. Mm-hmm. That makes sense to me. So here are some adverse side effects of birth control pills. I'm going to read down this list. There's a dramatically greater increase of blood clots in the blood vessels, thrombosis. There's a 4 times greater increase of dying of a stroke from a blood clot. 4 times the risk of heart attacks, 3 times a greater risk of double the risk of migraine headaches, increased risk of high blood pressure, increased risk of dying from cancer, particularly cervical cancer, breast cancer, endometrial cancer, and increased risk of ovarian cancer, or thyroid and liver cancers, altered immune function, a higher rate of birth defects and birthmarks in children who are conceived when a woman's on birth control pills, a higher rate of anti-anxiety and antidepressant use by women who are on birth control pills. So I'd highly recommend that you not use these counterfeit drugs that mimic hormones in your body and use natural hormones. So if you're having premenstrual symptoms, I don't care what age you are, if you're a teenager, 20, 30, 40, and you're still menstruating and you're having premenstrual symptoms of fluid retention, weight gain, breast tenderness, headaches, mood swings, and those happen prior to your period, that's a sign of low progesterone, a sign of estrogen dominance, two sides of the same coin. And what you do is take a little bit of progesterone, day 15 through 28 of your cycle, and that will take care of all those premenstrual symptoms, and you'll feel really, really well. That's what I'd recommend you do. So that's the story on birth control pills. They're dangerous, but they're used ubiquitously, and one of the reasons we have a host of health problems in America today is because of the use of these drugs that are counterfeit hormones and that mimic hormones in our body.
Absolutely. It's very clear that there are more downsides than upsides to using birth control pills. And like Dr. Hotze said, it can happen at all different ages. So some people think about natural hormones, bioidentical hormones, and they think middle age. We see plenty of people in our practice who come in at much younger ages, at teenagers. Their hormones just never got balanced. So if you have any of those symptoms or signs, then definitely go to our website. We've got a symptom checker you can go to at hotzehwc.com. It's HOTZEHWC.com. You can always give us a call for a complimentary consultation. 281-698-8698. That's 281-698-8698. Thank you so much for joining us here today at Dr. Hotze's Wellness Revolution.
Information provided on this radio program is neither intended nor implied to be a substitute for professional medical advice and is not intended to replace the services of a physician, nor does it constitute a doctor-patient relationship. You should not use information from this radio program to diagnose or treat a health problem or disease without consulting with a qualified healthcare provider. If you have or suspect you have an urgent medical problem, promptly contact a professional healthcare provider or call 911. Dr. Hotze's Wellness Revolution radio program advises you to always seek the advice of a physician or other qualified health provider prior to starting any new treatment or with any questions you may have regarding a medical condition. Any application of the recommendations from this radio program is at the listener's discretion.